So I want to introduce you to someone who I have looked up to for the last 4 years, Dr. Kirk Moore, and you guys have probably all heard his story. So, Dr. Moore, give us a little background on what you've been battling, what you've been facing, and how justice has prevailed in your case.
Well, as you know, and most of your audience may have already heard at some point, if they don't have their head in the sand. But I was indicted in 2023 for basically giving saline shots to kids instead of the COVID shot, and giving cards to their parents and or other patients that just didn't want to get the COVID vaccine. Um, I battled with that for about 2.5 years. We were just briefly talking about that on air, or off air, sorry. That they were claiming that I had defrauded them of $28,000 worth of product. So any normal government, any normal agency, any normal company would say, hey, look, just pay us back our money, pay a fine of 10 grand, and be done with it, right? But no, they probably spent $3 million prosecuting me, bringing in expert witnesses. They brought in the chief of BARDA. They brought in the ex-director, Chris Duggar from the CDC, who, took the 9-month payout that Trump offered. Otherwise, you're going to get fired. They, they just, it was $28,000 of the product. The first day of trial, okay, the sitting U.S. attorney, kind of the interim U.S. attorney, because there hasn't been one hired yet for the state of Utah, basically had his whole office, clerical staff and lawyers, anybody who could come in and sit behind the prosecution side just to show that their aisle was full behind their desk, because my side was just loaded with people, and there were people outside. We had an overflow room and everything else where, people were going to watch. And so in order to kind of make it look like at least there was some support for the prosecution side, he paid his staff to come and sit there for, I don't know, 4 to 6 hours, just to watch the case. So that just goes to show you that, again, this is not about justice. It's not about the truth. It's just about winning. And it's just about kind of, just like we were talking about with, all of the stuff that they've done to us and they continue to do to us, and everything else. It's about shutting us down. It's about censorship. It's about control, and loss of freedom. It's a tyrannical, regime in disguise right now.
Absolutely, absolutely. And what you did, you saved people's lives, because we know how deadly these vaccines are. I don't even like calling them a vaccine, but we know
Yeah.
what they've done, especially to the children, right? So as I'm wearing my shirt that stands the truth, the final variant is communism, and we're there. I mean, we're at it. And so we have to be able to stand up for truth. We have to be able to stand up for our patients. We have to be able to stand up for the parents that are choosing something for their child that they should have every right to. And that's being stripped. I'm in California. It's way, I mean, I don't think it gets any worse than this, but where is the right for parents to be able to choose what they want for their children? And as a medical provider, and we all took an oath of do no harm. And when you
Well, they
buck
don't do that anymore.
they
They
don't
don't
do
do,
that
they don't, they
anymore.
don't, they don't do it anymore in a lot of schools. But yeah, go ahead.
Yeah.
Sorry.
I mean, it's crazy. So your stance, I mean, you're a hero. You're a hero to me. You're a hero to a lot of other providers. You're a hero to these parents who came to you scared and worried. And it's so nice to actually see this day and age a case like yours being, you're free. They
Yeah.
let you no longer, and they'll keep beating you down and beat you down, beating you down until they hope you give in.
Right.
And
Yeah, I
once
mean,
you
it's again, the process is the punishment. They just want to win, and it doesn't matter what the cost is. Doesn't matter what the cost is to them. Doesn't matter what, it really, they kind of just lose track, I think, of what it is that they're trying to do. They kind of just put their blinders on, and they're just kind of like, my goal is to win. and so they just put this target on you.
Mhm.
And it really doesn't matter. It doesn't matter what you've done or what you haven't done. It doesn't matter what, especially in a case like this that has all the publicity behind it and everything else. Um, it truly just, they just lose track of kind of reality in a sense. And they just want to make an example out of you. And we were talking earlier about being canceled and censored and, shut
Mhm.
down. And I lost two of my Twitter accounts. I didn't, manage to kind of work my way around it with another username and phone number or something. And now that, whether you believe in Elon Musk or not, I still, the jury's out, I think, on that.
Right.
Um, but and no pun intended on the jury thing. um,
Right.
but
You have to see.
um, but it's, we're living in a society. I think it was Todd Callender, the attorney, that said to me once that somebody put out a list of like a list of 45 things that we had to reach in this country in order to become a communist country. And I think all but two of them have been achieved. Um, and so, I love your shirt, because we are. I mean, we're in a situation right now where it's truly dire. But
Mhm.
we have a society that, for the most part, is really apathetic. They really think that the government still has our best interest at heart. They trust in the government to do what's best. And really, they're not. They shut us down in 2020 to put up all these 5G towers around here.
Right.
They were still working. They're still doing all this stuff behind the scenes. They're still kind of like colluding and figuring out a way to, to make to surveil us and to watch us and to, invade our privacy even more. It's not as bad here in the US as it is in some European countries, but it's getting there.
Sure.
And we're still kind of the main mindset that, yeah, it's not happening, or it's really not what I think it is, or it's really not as bad as what people say that it is. I mean, it's actually worse.
Yeah. Yeah. I mean, if they can mandate this, I mean, so many things that the whole, and working in medicine to get that vaccine out there as an emergency use authorization, there could not be any kind of medication out there that could help with symptoms and help treat the disease or the virus that they were mandating these vaccines with. And so we're trying to get emergency use authorization with. So they squashed that. And so anyone that wrote for ivermectin was they hunted you down. And that was, I remember when I broke away from the urgent care, I was working at urgent care. They were forcing the vaccines on all their employees. And so I I actually caught COVID pretty quickly because I refused the vaccine. I was told I was a murderer. I was going to kill all these people. How dare I ever go against the system? Why am I in medicine? And then I took ivermectin and it was like in a couple hours I felt better. So when I went back to the urgent care, I'm like, I know I can't do hydroxychloroquine because that will flag me in the system. So I'm going to do ivermectin. And nobody knew what it was. We didn't know what ivermectin was. I didn't treat
Right.
scabies with ivermectin. So I started prescribing ivermectin. I got called out. I actually don't know if it was CVS that called me out or if somehow my boss found out. And I'm a PA, so I have my supervisor who comes in and she's like, what's the deal with with this ivermectin? And I said, well, what do you mean? I'm not telling my patients to wait until they can't breathe anymore to go to the ER. I'm actually treating them and I'm following up on them and they're doing great. It's a totally benign medication. And she's like, it's not FDA approved. I said, it is. It's been FDA approved for 50 years. I'm using it off label. But what's not FDA approved is that stupid shot that you think I have 5 more days to put into my arm. And she did not,
Right.
she didn't like that. That was not. And I walked out. I never went back. And when I left, I just went, oh my gosh, like I'm never going to be in medicine. I'm so corrupt. California, I have the vaccine to work. And so I walked away going, I don't have to swab another patient. I don't have to think COVID, drink COVID, sleep COVID. I'm done. And God goes, nah, this is all you're going to do for the next 3 years. And that's what I did. And so I just started, I drove to patients' homes. I started doing monoclonal antibodies and providing oxygen and pulling patients out of the ICU and pissing off the hospital systems and flying across country to pull patients out of the hospital in different states. It was crazy. But I knew I was risking it. But for me, it was like if I lose someone because I didn't stand for what was right, I can't lay my head down on that pillow. So I knew everything I was doing was putting my license at risk. But if someone died because I didn't stand for that truth, that was it. So I knew that, and it's never been a patient that's made a complaint. Quite ironically, it's been doctors who have alerted, ones that are pissed off because they're not making any money off me, or ones that are pissed off because I pulled the patients out of the hospital and the hospital doesn't, you know, make money
Right.
on killing that patient.
Yeah,
But
they don't get their 20% bonus.
yes, and I pulled them out, patients who've had 50% O2 saturation, and they're still alive, and they're now primary care patients of mine. And so they would have died in the system. But it's like the same stance you took, like, I can't, my conscience won't let me do this. I can't do this. I will fight the system. And if it means I lose everything, I lose everything, because I'm not going to murder anybody.
Right.
Uh, but it's
Well,
crazy
look,
that we are.
I'm a plastic surgeon, so I get a knock on me because, first of all, what's a plastic surgeon doing, doing vaccines? Secondly, why am I doing primary care? Why am I taking care of colds and flus? Um, and I have two arguments to that. One is I'm a doctor before I'm a plastic surgeon, period.
Yeah.
So, we all graduated from the same medical school, at the same time, and then we all differentiated from there. And then on top of that, I did, uh so from 94 to 2001, so 7 8 years, um I was basically a primary care doc. So I
Mhm.
was a flight surgeon in the Navy, and
Okay.
then when I went back to residency, I was moonlighting in ERs. I was taking care of colds, flus, headaches, heart attacks, strokes, all of that stuff. And I did that for, I mean, that's what supplemented my income, while I was in training, while I was in residency. I would, I'd take a whole weekend and I would work from a Saturday at 6 p.m. to Sunday morning at 10 p.m. 10 a.m.
Mhm.
And then, and fly back home and go back to my regular job, uh, my 80-hour a week job as a resident. So,
Right.
I have a lot of experience.
Yeah.
And just because I'm, specialized in plastic surgery doesn't necessarily mean that you lose all that. I had to refresh myself on, all of it. In 2020, I'm going back and looking through microbiology. I'm reading and watching and looking at videos. I mean, Vladimir Zelenko was the first guy that I found.
Yeah.
Um,
Yep.
and, just listening to him, I wish I could have met him. I would have, he's just, what he did and what he went through, and his
Mhm.
stance that he took. I believe, I might be wrong on this, and I've said this a few times. I think he's the first person to call this a bioweapon. I think he's the first person out there to call it. I think Michael Yeadon was close behind him, but he's not a physician. So, and I'm not knocking him. I mean, it's not like, he's a PhD. He's a very smart guy. I'm not saying that. But, first MD or DO or doc or whatever, to call this a bioweapon, I believe, was,
Mhm.
Vladimir Zelenko. And I just remember kind of like thinking to myself, dude, you better have some security. Um,
Right. Right.
and,
A
and then he
warrior.
dies of that kind of really strange adenocarcinoma, the pulmonary, pulmonary arterial adenocarcinoma or something like that. It was a
Mhm.
really weird cancer.
Right.
And but I didn't hear about ivermectin probably. I mean, until later in the year in 2020. Um,
Mhm.
and I started having to go to quercetin because they, you know,
Yeah.
they badmouthed me, even though I'd been on 3 humanitarian trips and I'd written hydroxychloroquine for all 150 people that went on our trip with us, as prophylaxis for malaria. So I knew very well, what the side effects were and what the risks were
Sure.
and everything else. And I'd read about, QT interval, and I read about the cardiac issues and all that. I mean, it was just so rare that nobody did it anyway, and everybody in Africa is taking it. So it's just kind of like, if you're going to see the problems, you would have seen them already, and you're not. So, it just goes back to, um, those, the Ash experiments, where you get the peer pressure, stuff. You go back to the, Mul Milhone, is it Mil, I can't remember the one where, people were shocking people, and the experts standing over their shoulder, and 2/3 of the people would actually give a deadly shock to somebody just because they answered the question incorrectly. And then what they figured out is that if they get you to do one thing, 92% of those people will do the next thing that they ask you to do. And so
Mm-hmm.
that's what they did, So they first thing they did is tell us that we needed to shut down,
Mm-hmm.
and avoid contact. So they isolated us, and then 92% of those people then started wearing a mask. um, and then the next percentage of people, 2/3, 3/4 of the United States got vaccines. I don't think it's that high. I think there's a lot more people out there like me. They just didn't get caught.
Yeah,
So,
well, yeah, I mean, I'm not gonna say any names, but there's some heroes that kind of did similar things in my neck of the woods. Um, and I have to say I was very tempted to do that, but my stance on like, absolutely no, I'm not falling for this, I'm not doing this. I didn't want my name in that database. So I just said, stand my ground. If it means I can't go to the grocery store, if it means that I can't go out for dinner, if it means that I can't do whatever, like this is where I'm gonna die fighting for this. One
right.
thing too, the medical board, because I had one of my supervising physicians, amazing guy, part of the frontline doctors, Dr. Peterson Pierre.
Oh yeah.
He's dermatology.
Right.
So he took me on when I was already battling some of the medical board stuff. And one of the questions that was asked was, well, what does a dermatologist know about a virus? And he said the
Right.
same thing. He's like, I'm an MD. I went through the same training. And here's what happened. So many doctors, and I'm not calling out just the doctors, PAs, mid-levels, they they ran. They tucked their
Yeah.
tail and they ran and they refused to treat anyone with any kind of symptom. Sore throat, I'm sorry, you can't come in. I have a headache, I'm sorry, you can't come in. So doctors had, providers, if they were in especially, had to stand up and do this because so many of them were chickens. They just went running for the hills
Right.
and they refused to actually step up and do what they were supposed to do, which was treat patients. And so
Right.
it brought out those that were like, oh my gosh, this is crazy. And I mean, it really showed who was strength of someone and then how quickly they can just fold.
Well, that was the first sign to me. First thing that when they said there was no treatment and you just leave people alone, wait till they're almost dead, and then you start treating them, that to me was so antithetical to what we had been taught and trained and
Mhm.
done. I mean, I use the analogy all the time that, I used to do a lot of breast reconstruction surgery. So the analogy that really kind of hit home to me was, a woman comes in with a nodule on her breast and you say, oh yeah, just go home when it's larger and it's eroding through the skin and you have this, ugly flesh eating wound, then come back and see me. That's when I'll take care of you. And so that's the kind of analogy that I would use because it just didn't make any sense.
Mhm.
Um, even if you're not going to solve the problem, or even if you don't know what the problem is, you still want to intervene. You still want to make people feel better. You still want to do something. And as long as you tell your patients that, hey, I don't know what the problem is, and I don't know if this is going to solve it, but based upon what it is that you're telling me, I think this might help you. That's all you
Mhm.
have to do. That's all that
Mhm.
people wanted.
Yeah.
Um, and that's the way I started too. I mean, you mentioned taking people out of hospitals. I did the same thing. I
Mhm.
took a neurologist that had already had a dose of remdesivir out of the hospital, saved his life. I took
Mhm.
another, the husband of one of my nurses, got him out of the hospital. And they wouldn't even put him on oxygen. He's in the ER and they're like, he's got a SATs, I think, of like 84%, and they're not even putting him on an oxygen cannula. So his wife kind of just goes through the cabinets, grabs an oxygen cannula out of there, puts it in, at least gets him to feel better and gets his oxygen level up a little bit. But they were like, oh yeah, you don't need it. It's okay. We're going to admit you here shortly and they'll take care of you upstairs.
Yeah. We'll
What?
kill you.
I mean, it's just kind of like, what? I don't, I, again, I don't think these people were doing that on purpose. I don't think they're looking at it from the standpoint of like, we're killing this guy, or I plan on killing this guy. But where did you stop treating that? Anybody else who comes in, I mean, you get like a 17-year-old kid that's kind of in an ambulance that got run over, or had a motorcycle accident. He's going to come in on an oxygen cannula with oxygen, just as a prophylactic measure. Okay. And
Right.
now you've got somebody in there complaining of difficulty breathing, and you're still not going to put them on oxygen. It just,
Right.
it's just kind of like, none of this stuff made sense.
Yeah.
Um, all 200 countries doing the same thing, and then nobody gets
Mhm.
back to normal until we have a vaccine and a shot in everybody's arm. Those three things to me just kind of, that's what drove me, to I was treating people. I mean, look, I lost my hospital privileges because I wouldn't wear a mask. I got turned in 3 times, finally got taken to the principal's office, and I said, I'm not going to wear a mask. I said, that's our hospital policy. I said, here's a stack of papers that talks about masks that don't help.
Yeah,
Mask and surgery helps me. Okay. It protects me from people splashing me with blood and feces and fluids and and sputum or whatever it is. So I'm not protecting the patient. I'm protecting myself is what it is.
yeah,
Um, and I'm not going to drool in my patient's wound while I'm operating. Why am I wearing glasses? Am I going to cry into their wound? And you worried about them getting so I mean everything got turned upside down. um
yeah,
and so I lost my board certification because now I don't have hospital privileges, so I can't transfer my patients from my surgical center that I own, that I work in. So I have to have it accredited, so I lose my accreditation because I don't have hospital privileges, and then I lose my board certification because I can't have an accredited facility because I can't transfer my patients to a hospital. So, and that's just the way I live right
please.
now.
So
And
that's still the case.
yeah, yeah. So I'm toying with whether I should apply for hospital privileges again. Part of me says I don't want to do that. It really makes no difference to me. I had my board certification for 20 years. I haven't had anybody push back on me. If somebody asks me about it, I'm not embarrassed to tell them that I lost it over this fiasco. Um,
Yeah,
it's made my malpractice insurance a difficult concept too. Um,
sure.
but it's you know and in the end, what do I need malpractice insurance for if I don't have to have it for hospital privileges? Because that's the other,
Right.
you know what I mean? So it's just kind of like,
Yeah.
if I tell my patients, hey, look, I'm going to do the best I can. You want to sue me, you can sue me, but I'm a good surgeon and I've had this, et cetera. It's just it's just that kind of domino effect of one thing after another. So really, we're in interesting times right now, Sarah.
It's nuts. Do you find, I think my stance and my take on everything has attracted a flow of patients that I actually would want in my practice. Do you find that because of your stance and what you represent and who you are has actually increased your practice, like the patient load, because people are, they appreciate what you've done? Have you seen that in your practice yet?
Well, I no, I don't know that it's increased my patient load, but it's made them more appreciative of who we are. Um,
Hmm.
and most of my patients come to me because of the stance that we took.
Yeah,
Um, and it was a struggle for me for the last 3 years. Business wise, all my expenses were legal expenses.
right.
I mean, I spent, between 700 and 800 grand on attorneys.
It's
So I
crazy.
stopped all my marketing.
Mhm.
I've had to borrow money just to kind of make payroll and, and do all that. Things are maybe turning around a little bit now that I'm not spending that, you know, 50 grand a month on my
No more
attorneys.
attorneys.
I can put that back towards marketing and everything else. We're changing, we've um, rebranded the practice to like a Freedom Surgical practice. So
Hmm.
Freedom Surgical and Aesthetics. Um,
Awesome.
and just kind of hoping to take advantage of the publicity over all of this that we've taken, and put us
Hmm.
in the right in the right vein. You mentioned this earlier in kind of in passing. Whatever happened to the Me Too movement, right? My body, my choice. Okay.
Right.
I mean, it's just kind of like my body, my choice back in 2016, 2017. I get the chance. If I want an abortion, I can have an abortion, and, you're not going to tell me what to do. Well,
Hmm.
what's worse? An abortion, the choice of an abortion or a forced vaccination, and, compliance, and doing everything that the government wants you to do in order to kind of participate in society. Whatever happened to my freedom, to those freedoms and, my body, my choice? That's, nobody ever asked that question except
No,
us.
well, at least it's not on the news, because I think all of us standing back, that's definitely that needs to be addressed, and the name calling and I mean, really a lot of the people that are pushing these vaccines, it's just repetition. It's like they're just regurgitating what they hear. If you challenge them, if you question them, if you show them the data, they can't handle that. They just keep regurgitating and we, I mean, I'm sure you saw it and faced it, the name calling and the gaslighting and the threats and you're like, what? It needs to make sense for me. Like the mask, like make it make sense. If it makes sense, like, okay, we're going into a restaurant. I have to wear my mask to walk into the restaurant. But once I sit down at the table, I can take my mask off. But then as soon as I have to get up and go to the bathroom, before I stand up, I have to put my mask back on. And I go to the bathroom. Like it doesn't make any sense. If it actually, if there was logic behind it, I think that more people would do it. But it was this, it was a test. I
Yeah.
mean, it really was a
Well,
test.
it's funny that that whole scenario of the whole restaurant scenario. Um, I, my son was going to be forced to wear a mask in middle school. Um, and at the time I had the ability to do this. And so I wasn't going to make him wear a mask.
Sure.
So I actually sent him to Switzerland for a year in school.
Um,
Um, and I grew up overseas. I grew up in Italy, and so it was, it's kind of, it was great. And so I went to visit him, and there was one time there's this place in northern Italy, which is close to where I grew up, that I buy
mhm,
wine from, and I usually bring back a case or two of wine when I come home. So I went in there to buy some wine, and it was full blown COVID. Okay, um, we're talking end of it was probably either end of 2020 or beginning of 21, somewhere around in there. And I went into this, it's a restaurant winery. Um,
mhm,
and I mean it's their table wine. I mean, it's $10 a bottle. Okay.
mhm,
It's really cheap, but it's just one of the best wines I've ever had. Um, and so I'm in there and the restaurant's pretty full. And I walk in and all these people are sitting down at a table and nobody has masks on, everybody's talking. Um, but I don't have my mask on either.
mhm,
And so I'm, like I said, I'm standing, I'm 6 feet tall. So I'm standing, I'm 6 feet above the ground. And all these people sitting at this table right behind me. There were about 12 people sitting at this table right behind me. And we were in Italy. And I grew up there, so I speak Italian. And they were yelling at me. They were like, put your mask on, put your mask on. And I turned around at them and I was just like, look, guys, you're literally 18 inches below me. And I was just like, so do you think the virus lives at your level or it lives at my level and not at your level? And so it's going to contaminate you versus, I mean, literally had an ongoing fight over it. And the lady that I was the owner, the proprietor of the place there knew me because I'm the only American who comes in and buys, buys wine in bulk.
sure.
And she's like, oh, here, let me hurry up and get you out. Come on, let's go. And she's just like, I'm not gonna make it. You don't have to put your mask on, but let's just leave them alone. But it was that exact scenario. It's just kind of like,
Yeah.
where did your common sense go? I mean,
Yes.
seriously.
Yeah.
And so some of the people sitting at the table started putting their mask on. It was just like,
Oh no.
oh my
And
God. It's
somehow
just
it's
like,
trickling down from up here to on
right,
them. Yeah, I mean, the common sense is gone. One thing too with the hospital stuff and did these doctors did they know that they were murdering patients? And I call it murder because that's what it was. They needed the check boxes, right? You needed to be admitted, you needed to have a positive COVID test, you needed to be given remdesivir, you needed to be put on a ventilator, and then you needed to succumb to your illness. And that was going to give you the hospital the biggest bonus. So maybe some of them didn't, maybe some of them did. But, I worked in hospital setting for 10 years and we do huddles. We talk about the protocols. We talk about things. Is this working? Is this not working? And I remember going off on one of the nurses who had one of my patients in the hospital. And I said, you guys do huddles. I know you do huddles. Oh yeah, of course. And I said, do you guys ever talk about like we're killing people that actually when someone gets admitted and onto your floor, they're okay. Their O2's, 90, 92%. They're on 2 liters. They're doing fine. You give them remdesivir and they all die. Like, doesn't that get addressed? And I mean, I challenged her on that. I said, it's funny that my death
right,
rate outside the hospital and my patients are just as sick as yours are is zero.
right.
But 60, 70% of your patients in the hospital are dying.
Okay.
And so what are you doing what is it? And and that there's that common sense, like, okay, I know. And the nurses would say, like, we call it run, death is near, because that's what it was. And so for me as a provider, if I saw that and I was working in a hospital, I can't partake.
Right.
I gotta sound the alarm. I gotta do something. I would have been fired anyways, so whatever. I quit before they could do that. But it's back to that common sense. And so maybe they weren't at first going, God, we're actually killing people, but over and over and over and
Well, at some
over and
point you
over
gotta,
again.
right, you're absolutely right. At some point you've got to just look at yourself and just kind of go, how do you go home? How do you put your head on the pillow and how do you sleep at night? Knowing that, that guy just there in room 302 came in with an oxygen saturation of 92, a little shortness of breath, and maybe he was insulin dependent diabetic, and then 48 hours later, 72 hours later, he's dead. Okay.
Right.
How many of those people would have died in 2019? None. Okay. And
Yeah.
like you said, I mean, I took care of um in 2020 6 to 800 patients, and then through 23, you count them on, well, again, with the COVID vaccine, I don't really count those as my patients necessarily, even though they were, but um
Mhm.
but I took care of well over 1,200 patients that, I was treating them for COVID-like symptoms,
Mhm.
flu-like illness.
Mhm.
And I didn't have one patient go to the hospital. I didn't have one patient die. Um,
Mhm.
and, Vladimir Zelenko was the same way. All the
Yeah.
FLCCC guys were the same way. Pierre Corey, Paul Merrick,
Mhm.
all those guys, treating people, treating them early. But we all got shut down, and we all got censored. Nobody's speaking up. I know a lot of congressional members that are vaccine injured and they still won't speak up. Okay. And they still won't say anything. Nancy Mace is one of the only ones that I know that has actually said something. Um,
Mhm.
and even then, she still didn't come out and jump on the bandwagon to defend me. I mean, she's just kind of
Right.
like, hey, Nancy, look over here. Marjorie Taylor Greene did, and Thomas Massey did, and Mike Lee, did. Um, but where are you? Ron Johnson's out there kind of having hearings every 6 months in the, Senate committee hearings and
Right.
exposing all this stuff. Rand Paul finally, I think, last month or, just a few weeks ago, yeah, well, last month in July, I think finally kind of, took some meetings with some people, with Breanne Dressen and her group and everything else. Um, but gosh, I mean, it's 5 years. I mean, what's taking these people so long? And it's just, it's a real struggle for me. Um, and, I mean, I, it's, um, I've had this question asked of me, and maybe you know this too. How many people that you talk to, of your colleagues, of your docs, of NPs, PAs, even nurses, anybody that you had those discussions with about what are you doing? You realize you're killing people. You realize you're doing this. How many of them have come back to you and said, "Hey, you know what? You're right. I'm sorry." I haven't had anybody, not
No,
one, okay? And
no.
I know that there's people out there that are thinking it. What's
Mhm.
keeping them from doing that? Why can they not, say, "Hey, I made a mistake," or, "I really wish I'd have done this differently, and next time I will do it differently." What's keeping people from doing that? It's a real struggle for me, and because if they can't do that, then I don't really even wanna be part of that. I
Right.
really don't. I want to start my own, I mean, Jack Cruz talks about it, it's just kind of like
Yeah.
decentralized medicine,
Yeah.
and just,
Yeah.
completely get out of the system and, and everything else. You're kind of doing that with your indigenous license, that's,
Mhm.
Margaret Aranda has kind of gone down the same
Yeah.
road. Um,
Yeah. Yeah.
and, it's really disconcerting. It's really disillusioning, that we have a profession right now that doesn't have the ability to, look inside itself and to, and to kind of like realize that, hey, we're self-censoring, because we're fearful for our jobs. Whereas if 10% of us, not even 5%, would have pushed back and said something, there would have been enough of an uproar and enough of a disruption in medical care that something would have happened, and it wouldn't have been what did happen.
Absolutely, absolutely. And that because they're not willing to do that, I mean, I've actually I had one gal who came to me vaccine injured. Her father was a physician, is a physician, and pushed the vaccines, and he encouraged her to get it. She got it. She was vaccine injured. Her mom was vaccine injured. And I never met him, but I did treat her and treat her mom. And she told me that he had remorse, that he like he, you know, he's apologetic for what he did, but there's not enough of that. And so there's no
But even
faith.
that remorse, why isn't he coming to you and saying, "Hey, thank you," or why isn't he standing up and saying, the only guy that I know that I've seen that's public that way is Dr. Asim Malhotra, the guy from England, the cardiologist. Okay,
Yeah,
he recommended the vaccines. I think he might have even been vaccinated. His dad died from vaccine injury. He's the only one that I know of that has done a 180 on this.
yeah,
And been public about it. I might be
yeah.
wrong. Look, there's probably other people out there. I'm certainly not covering the blanketing the whole internet and everything.
Not enough.
But
Not
yeah,
enough.
but I mean, one that I know of out of all
Yeah.
of this, I mean, we should be talking to hundreds of people that are just kind of like, we should have, when we were at when we were at the America's Frontline Doctors there at SCOTUS, we should have hundreds of doctors out there going, "Hey, you guys were right. You guys were
Yeah.
right. I'm sorry. We'll look at it and, and we'll kind of change our ways a little bit and just kind of be a little bit more open-minded." Um,
Yeah.
but, Sarah, I'm sorry, I'm talking a lot, but,
No,
um,
that
it, the, how long have you been in practice?
I've been a PA for over 15 years, but
Okay.
broke away in 2020. So
Okay. So 10 years. In those 10 years, how many times had you been to the CDC website to ask them for advice on how to take care of your patients?
never.
Okay. And I had neither. And I still don't go there for advice. I still go now I
No.
go just to look at what garbage they're putting out. But that's the thing to me is clinicians, people that are busy and people that are taking care of patients, they don't go to the CDC website. I mean, the worst thing you do is maybe if you're taking care of an ER patient or you have somebody coming into the clinic who's claiming they were poisoned about something, you might call poison control. Okay. And that's it. And that's a phone number. You're not getting on the CDC website looking for it. You don't have time to do that.
Yeah.
You're calling poison control. Hey, I got somebody in here who just swallowed a half gallon of turpentine. And,
Yeah.
and what do I do about it? Okay.
Yeah.
So, but nobody has ever been to the CDC website. And all of a sudden now the CDC, the people that are at the CDC who've never taken care of any patients ever in their lives, okay,
Right.
are all of a sudden the experts that everybody looks at. And it's crazy how we've, morphed our society into, listen to these, medical bureaucrats, telling us how to take care of our patients when we're the ones that are on the front lines.
Right. Well, and now the trust in the system. So patients come to me, I do concierge, I don't take insurance. I have not taken insurance since I broke away, and nobody trusts. I don't trust. And so we have gotten to a point where until providers can come forward and say, I was wrong. I believed what I was told and I'm apologizing. I'm sorry. And I contributed to this, and that. We have to completely dismantle the medical system in
Yeah.
America for any trust to be rebuilt. The vaccine percentage of new parents vaccinating their children is at an all-time low. And with that
40%,
distrust in vaccines, yeah,
40%.
now American Academy of Pediatrics is now saying we don't even want, instead of saying, let us
I know they're
rebuild the
panicking.
yeah, it's
They're
crazy.
panicking.
So there's not, I mean, if I have a patient, I mean, I've had this where I have a patient who's got chest pain and I'm like, here's your aspirin. You have to go to the ER. They're like, I'm not going. They'll kill me.
I
I'm
know.
like,
Right.
I know, but we kind of, this isn't COVID. But that is how much the trust has completely been taken away. And it's because of the actions of the medical providers who should have stood their ground and said, we know enough about masks that we know that we should have been the first profession that said masks don't work instead
Right.
of the last profession to mandate it when patients come into our practice. Like we should have been the ones standing first and in the front line going, this doesn't work. We know this. This is in our education. This isn't, I want to keep my surgical field sterile. So if I sneeze, it doesn't go everywhere, but it's not preventing me from catching anything or them catching anything. we have to completely destroy it. There is no rebuilding. I'll never take my kids into a pediatrician's office. I will never
No,
vaccinate my child with anything ever again. I wish I'd known then what I know now.
right.
But there's no trust. And so people are flocking to providers like you, providers like me, because the ones that didn't get the vaccine already didn't trust. But I don't have any patients that took that vaccine and are happy they took it. 100% of my vaccinated patients wish that they never took it. 100%. So they will never trust that again. But
Right.
if we
You don't have anybody, you don't have any of your patients that didn't get vaccinated that are going, oh, I better go get my vaccine now.
no,
And they
no.
didn't
In
feel bad.
fact, they're like, they won't even go to the hospital when they're having a heart attack. I mean, that's how much they don't trust. They would rather die. They're like, I would rather die at home than go there.
Well,
And that's,
I had a half dozen transplant patients that would rather have died than get the COVID vaccine.
isn't that crazy? And how crazy that you needed to get the vaccine to qualify for a transplant.
Right. Right.
Who decides that? And no, so it is, we are a broken system. I can't remember who this doctor was. It was one of Angie Frella's conferences I went to. This was in Conroe, Texas, and I think he's in Kansas. And he talks about a hospital system, a surgical system where it's just all cash pay. And that's kind of what we have to get back to, because
Right.
insurance is corrupt, pharmacy is corrupt, and so get to a cash pay system where people can actually choose the providers they want. They'll pay cash for whatever. Everybody's happy and there's trust in the system again. But
Right.
we will not, there's no repairing what happened the last 5 years unless we completely dismantle it and rebuild. And
Well,
that's what
yeah, I completely agree with you. I've been, everybody kind of says that, the plastic surgeons were kind of in general, not all plastic surgeons, because some just still do take insurance and do, reconstructive cases, but I've never taken insurance. And, all my ER call was gratis, was just pro bono. I'd go to the ER 5, 6 times a year, take care of somebody. A couple times I even took somebody back to the OR, still didn't bill them, didn't do anything. It was all on my time. I just wasn't going to hassle with the insurance reimbursement and, and everything else and being told what to do or how much I was worth or anything else. I just did it, I mean, I had, a dog take some kids, I think he was 6, 7 years old, took half his face off. And, I took him to the ER, took him to the OR and was there for 3, 4 hours putting things back together. He still comes in and see me. I think he came in, he's 17 years old now.
wow.
And he came back and they came back because of because of my stance. They came in, he didn't, not much, but his mom brought him in and said, and she wanted to give me a hug. She goes, thank you for what you did.
Mhm.
But it's just, I mean, it's just, we have to get to that full disclosure again.
Yeah,
We can't just, we have a mentality now, well, my insurance will just cover it. Well, so I had my son, needed an ACL reconstruction. And, um, and they wouldn't take, so I have one of those, healthcare, the kind of Christian healthcare plans.
sure. Yep.
Um,
Yep.
and they didn't take it, or it was a pre-existing condition on a rescope because he'd had his ACL reconstructed. And then he tore his meniscus, so I needed to go back in. And so the bill would have been like, I don't know, $16,000, $17,000. Okay. And I said, well, what's your cash pay option? Oh, it's $6,200. Okay.
Yeah.
So I was just like, okay, well, what do you need? Well, we need half down now and you pay the half after surgery. And I said, okay, let's just do that. But that's what we need. We need that, I mean, if they're going to charge me 40% of what they would typically charge an insurance company, what does that tell you? That tells you that one, the insurance company isn't paying that amount anyway. Two, that the hassle of having to bill them and rebill them and go through the denials and this box wasn't checked or, whatever, is just expensive for them. So we just need to get back to that full disclosure. Put your prices up. I think you're right. I think there is that surgical center in Kansas that has their prices online about, what
Yeah.
it costs for a gallbladder removal and what it costs for an
Yeah.
appendectomy, and everything else. Um, And you're right. I mean, it's just kind of like that's kind of what we need to get to. We need to get to change the mentality of like, oh, my insurance will just cover it. I'm paying $1,000 a month, and I have a $5,000 deductible, and okay, I've already met my deductible, so let's just go to get this stuff done. I mean, it's kind of like the mentality when I was in the military. Hey, we're getting to the end of our fiscal year. We've still got $80,000 in our budget. Let's just go on a flight and go to, we're in Meridian, Mississippi. Let's go to Memphis, Tennessee, and go watch some concerts and come back. We've got money in the kitty. That mentality and I remember thinking about that too. I was just like, God, is that kind of where we've gotten? It's just,
It
um,
is.
it's true.
Yeah.
Anyway.
Yeah.
You and
Well,
I
and
would
you
never
can't
do that with
trust.
our budget at home. Oh, I've got,
Oh, no.
I planned on, spending $4,000 in groceries this month, and I've only spent three, so I better go to Costco and spend $1,000. No, we don't.
Right.
You just kind
No.
of, oh, okay, well, I'll take that $1,000 and put it aside, and maybe I'll get my husband or get my kids something nice, or what I mean. It's just kind of like you turn that around, or I'll just save the money. Um,
Right. Right.
yeah. Anyway.
Yeah. I mean, it's a broken system. It is. We got to repair it. I don't know how, other than more and more providers I know are doing cash pay, and a lot of my patients are backing off on uh, the tiers of what they're willing to pay for insurance. So they're like, I'm just going to get like the bare minimum. If I end up in a car accident, that'll be covered, but I'm going to pay out of pocket, because insurance companies are going to dictate who you can go see, and they're
Right.
going to dictate the type of medicine that you're going to be able to get. So you're still in that cesspool of, it's all part of what we need to get rid of.
Right.
So we'll see what happens, but I thank you for standing your ground. It's so nice to finally have for you to be exonerated. I mean, what a blessing. I'm sure that the weight off your shoulders is wonderful. I still battle the medical board. They hate what I do. I hate what they do. And we'll just keep
Hey,
battling.
well,
They
it's a
want
mutual
to take
hate.
away.
You're good. It's a
Yeah.
mutual hate. It's just kind of like it's an equal pushback. Nice job.
Yeah, it's crazy, but so thank you so much. And if you're accepting patients, we'll promote you as well. So thank you for standing your ground. You're a hero to many. You saved a lot of lives. You protected a lot of lives. So thank you so much for doing what you've done.
Okay. Well, thanks for having me on, Sarah. I really
Absolutely.
enjoyed it.
Absolutely.